John Sherrick shares how healthcare workers are dealing with this influx.
This was a rough day for COVID patients filling hospital beds across the state. This was a rough day for ER doctors and nurses.
The majority of us are just exhausted.
Dr. Murdad Etishami, an ER physician in Atlanta, says unlike before, he is seeing serious COVID in otherwise healthy younger people in their 30s and in children.
Today, for example, I saw several patients in their 30s and 40s and pediatric cases as well, cases that were not severe back in February, but I'm seeing definitely moderate to severe cases now.
Dr. Sherry Drenzik, the state epidemiologist with the Georgia Department of Public Health, says all but a few of those patients are unvaccinated, including children with severe cases, unlike before the Delta variant emerged.
This Delta spread is very different than really essentially the pandemic version we were dealing with one summer ago. It behaves much, much differently.
But she says vaccinations can stop or slow the Delta variant from spreading. Look at the 6 counties in northwest Georgia. Their vaccination rates are lower than the state average, and 23% of the hospital patients have COVID. By contrast, in Atlanta, in Fulton, DeKalb, and Gwinnett counties, where vaccination rates are higher than the state average, just 13% of the hospital patients have COVID.
It's really hard to look at somebody who you know is dying when they didn't have to be.
But still, vaccines remain a tough sell, even during this spike in COVID hospitalizations.
All right, thanks a lot, John.